Doctors and nurses of Reddit, what has been your most gory, disgusting, or worst medical experience? Mine would have to be when I volunteered as a nursing assistant at the local hospital. On the first day I was there, I was asked if I'd like to assist in bathing an elderly patient. I was told he was near comatose, riddled with cancer, and was on death's door. I agreed, but nothing could prepare me for the sight of him. His pallid skin was stretched over his bones, and his eyes were dull and staring. Most of his skin was purple where his blood vessels had ruptured. He couldn't even speak and screamed when myself and the other nurse had to roll him over. He was constantly injected with morphine because of the pain. 2 days later, he passed away. I decided the medical profession wasn't for me.
As a paramedic, we responded to a call of traffic accident. Baby ejected. We prepared for the worst we could imagine. Arriving in about 8 minutes, a trooper on scene was working to clear the area of bystanders and preserve the scene. He had covered what he believed to be the baby with a yellow sheet. Upon lifting the sheet to check, it turned out not to be a baby, but the upper half of a 19-year-old woman who had been driving a small pickup truck about 50 yards away. She had been arguing with her 19-year-old husband, who was the passenger. Driving at approximately 55 miles per hour on a 2-lane road, her vehicle collided with an oncoming truck pulling a large mobile home. The impact caused catastrophic injuries. Her lower half remained in the driver's seat, while the truck skidded another 50 to 60 yards, sideswiping a minivan, which ended up in a ditch. Her lower half eventually fell to the ground when the truck came to a stop. A grim trail of tissue and debris stretched from the cab to the truck bed and down the road. Her husband, who was physically unhurt, was understandably traumatized. He became hysterical, babbling incoherently and lashing out in distress. A nearby witness to the scene experienced chest pains and required medical attention. Medical control authorized us to administer medication to the husband to help manage his acute distress, which was beyond our standard protocol. The driver of the truck pulling the mobile home, though unharmed, was also shaken by the incident. This happened 16 years ago, but the memory of arriving at that scene remains vivid as if it were yesterday. I used to be a nurse's aide. I once had to put a very obese woman on the bedpan. She was only mid-40s, and I left. She put her call light on, and when I answered, she said she was all done. I turned her on her side to remove the bedpan, only to see that it is empty. My first thought was that she had been mistaken about having pooped. But then I look and realize that her ass cheeks were so massive her entire dump couldn't make it the length of her cheeks and had gotten wedged in between them. I had to dig the entire load out of her by hand. It was only about 2 months into the job and it gave me some serious second thought.
I was taking call one night, and woke up at 2 in the morning for a general surgery call. Pretty vague, but at the time, I lived in a town that had large populations of young military guys and avid meth users, so late-night emergencies were common. Got to the hospital, where a few more details awaited me. Pararectal abscess. For the uninitiated, this means that somewhere in the immediate vicinity of the asshole, there was a pocket of pus that needed draining. Needless to say, our entire crew was less than thrilled. I went down to the emergency room to transport the patient, and the only thing the ER nurse said as she handed me the chart was, "Have fun with this one." Amongst healthcare professionals, vague statements like that are a bad sign. My patient was a 314 pounds Native American woman who barely fit on the stretcher I was transporting her on. She was rolling frantically side to side and moaning in pain, pulling at her clothes and muttering Hail Marys. I could barely get her name out of her after a few minutes of questioning, so after I confirmed her identity and what we were working on, I figured it was best just to get her to the anesthesiologist so we could knock her out and get this circus started. She continued her theatrics the entire 10-minute ride to the OR, nearly falling off the surgical table as we were trying to put her under anesthetic. We see patients like this a lot, though, chronic drug abusers who don't handle pain well and who have used so many drugs that even increased levels of pain medication don't touch simply because of high tolerance levels. It should be noted, tonight's surgical team was not exactly wet behind the ears. I've been working in healthcare for several years already, mostly psych and medical settings. I've watched an 88-year-old man tear a 1-diameter catheter balloon out of his penis while screaming, "You'll never make me talk." I've been attacked by an HIV-positive neo-Nazi. I've seen some shit. The other nurse had been in the OR as a trauma specialist for over 10 years, The anesthesiologist had done residency at a level 1 trauma center, or as we call them, knife and gun clubs. The surgeon was ex-army, and averaged about 8 words and 2 facial expressions a week. None of us expected what was about to happen next. We got the lady off to sleep, put her into the stirrups, and I began washing off the rectal area. It was red and inflamed, a little bit of pus was seeping through, but it was all pretty standard. Her chart had noted that she'd been injecting 4 drugs through her perineum, so this was obviously an infection from dirty needles or bad drugs, but overall, it didn't seem to warrant her repeated cries of "Oh Jesus, kill me now." The surgeon steps up with a scalpel, sinks just the tip in, and at the exact same moment, the patient had a muscle twitch in her diaphragm, and just like that, all hell broke loose. Unbeknownst to us, the infection had actually tunneled nearly a foot into her abdomen, creating a vast cavern full of pus, rotten tissue, and fecal matter that had seeped outside of her colon. This godforsaken mixture came rocketing out of that little incision like we were recreating the funeral scene from Jane Austen's Mafia. We all wear waterproof gowns, face masks, gloves, hats, the works, all of which were as helpful as rain boots against a fire hose. The bed was in the middle of the room, an easy 7 feet from the nearest wall, but by the time we were done, I was still finding bits of rotten flesh pasted against the back wall. As the surgeon continued to advance his blade, the torrent just continued. The patient kept seizing against the ventilator, not uncommon in surgery, and with every muscle contraction, she shot more of this brackish gray-brown fluid out onto the floor until, within minutes, it was seeping into the other nurse's shoes. I was nearly 12 feet away, jaw dropped open within my surgical mask, watching the second nurse dry heaving and the surgeon standing on tiptoes to keep this stuff from soaking his socks any further. The smell hit them first. Oh God, I just threw up in my mask. The other nurse was out. She tore off her mask and sprinted out of the room, shoulders still heaving. Then it hit me, mouth still wide open, not able to believe the volume of fluid this woman's body contained. It was like getting a great big bite of the despair and apathy that permeated this woman's life. I couldn't fucking breath, my lungs simply refused to pull any more of that stuff in. The anesthesiologist went down next, an ex-NCAA-D1 tailback, his 6'2" frame shaking as he threw open the door to the OR suite in an attempt to get more air in, letting me glimpse the second nurse still throwing up in the sinks outside the door. Another geyser of pus splashed across the front of the surgeon. The YouTube clip of David at the dentist keeps playing in my head. Is this real life? In all operating rooms, everywhere in the world, regardless of socialized or privatized, secular or religious, big or small, there is one thing the same: somewhere, there is a bottle of peppermint concentrate. Everyone in the department knows where it is, everyone knows what it is for, and everyone prays to their gods they never have to use it. In times like this, we rub it on the inside of our masks to keep the outside smells at bay long enough to finish the procedure and shower off. I sprinted to the OR central supply, ripping open the drawer where this vial of ambrosia was kept, and was greeted by an empty fucking box. The bottle had been emptied and not replaced. Somewhere out there was a godless bastard who had used the last of the peppermint oil, and not replaced a single fucking drop of it. To this day, if I figure out who it was, I'll kill them with my bare hands, but not before cramming their head up the colon of every last meth user I can find, just so we're even. I darted back into the room with the next best thing I can find, a vial of mastisol, which is an adhesive rub we use sometimes for bandaging. It's not as good as peppermint, but considering that over 1/3 of the floor was now thoroughly coated in what could easily be mistaken for a combination of bovine afterbirth and maple syrup, we were out of options. I started rubbing as much of the mastisol as I could get on the inside of my mask, just glad to be smelling anything except whatever slimy demon spawn we just cut out of this woman. The anesthesiologist grabbed the vial next, dousing the front of his mask in it so he could stand next to his machines long enough to make sure this woman didn't die on the table. It wasn't until later that we realized that mastisol can give you a mild high from huffing it like this, but in retrospect, that's probably what got us through. By this time, the smell had permeated out of our OR suite, and down the 40-foot hallway to the front desk, where the other nurse still sat, eyes bloodshot and watery, clenching her stomach desperately. Our suite looked like the underground river of ooze from Ghostbusters 2, except dirty. Oh so dirty. I stepped back into the OR suite, not wanting to leave the surgeon by himself in case he genuinely needed help. It was like one of those overly artistic representations of a zombie apocalypse you see on fan forums. Here's this one guy, in blue surgical garb, standing nearly ankle-deep in lumps of dead tissue, fecal matter, and several liters of syrupy infection. He was performing surgery in the swamps of Dagoba, Except the swamps had just come out of this woman's ass and there was no Yoda. He and I didn't say a word for the next 10 minutes as he scraped the inside of the abscess until all the dead tissue was out, the front of his gown a gruesome mixture of brown and red, his eyes squinted against the stinging vapors originating directly in front of him. I finished my required paperwork as quickly as I could, helped him stuff the recently vacated opening full of gauze, taped this woman's buttocks closed to hold the dressing for as long as possible, woke her up, and immediately shipped off to the recovery ward. Until then, I'd only heard of alcohol showers. Turns out 70% isopropyl alcohol is about the only thing that can even touch a scent like that once it's soaked into your skin. It takes 4 or 5 bottles to get really clean, but it's worth it. It's probably the only scenario I can honestly endorse drinking a little of it, too. As we left the locker room, the surgeon and I looked at each other, and he said the only negative sentence I heard him mutter in 2.5 years of working together. That was bad. The next morning the entire department, a fairly large floor within the hospital, still smelled. The housekeepers told me later that it took them nearly an hour to suction up all of the fluid and debris left behind. The OR suite itself was closed off and quarantined for 2 more days just to let the smell finally clear out. I laugh now when I hear new recruits to healthcare talk about the worst thing they've seen. You ain't seen shit, kid. ERRN here. This, so far, is the only death I've experienced from work that I've lost a significant amount of sleep over. 24-year-old male walks into the ER with complaints of flu-like symptoms for the past 3 days. He had decided to come in that day because he started to develop a rash throughout his body that he was unfamiliar with. Sadly, this rash was actually the result of a failed battle with bacterial meningitis, causing him to bleed internally and externally. By the time we got him back into the ER, he started crying blood and the terror in his eyes was palpable. He went downhill fast. His lucidity diminished with his blood pressure, and the last thing he said before succumbing to pulseless VTOC was something about his mother that we could not make out. You could see his consciousness fade from his eyes as we started compressions. The code lasted close to an hour. At first we could still keep his oxygen levels up with mechanical ventilation, defibrillation, and drugs, but blood was filling his airways faster than it could be suctioned out. He was bleeding too fast for any medications or fluids to keep his blood pressure up. He died soaked in blood and nearly unrecognizable due to his now almost uniformly purple skin and swollen face. We later found out that he was studying neurobiology, had a devoted girlfriend that was for all intents and purposes a fiancé, a large family, and many friends. He was an athlete who lived healthy. He had beautiful curly hair. This made the death tragic in a way that you just don't experience when a 80-plus-year-old dies. It made the unanswered pleas to God for help that had been sent echoing around the room by his family all the more bitter. I helped drag and push him into a body bag. A few years back when I was a medical student, I was doing my primary care rotation when I had to see a morbidly obese lady for a gynecologic issue. She said she was having a lot of itching and soreness in her vagina. Even as I set up for a pelvic exam, I could already tell it wasn't gonna be good. I could smell a foul odor already and I haven't even looked. I was gloving up when I got so nauseated and I was about to get sick. So I excused myself and lied to my attending that I had a problem taking a look in her cause she was so obese and I didn't have much experience with such a challenge. The truth was I just couldn't stay in the room. It smelled like rotting vagina. A few minutes later my attending calls for me to show me what he found. I thought for sure it would be an aborted fetus, but I was wrong. I go in with my mask and there my attending dangles this cylindrical object covered with bloody debris. It was a fucking tampon. She apparently had difficulty removing it a week ago. My attending kept saying it stinks like a mag. The embarrassed patient was crying and I felt bad, but I had to step out of the room cause I was starting to regurgitate my saliva and was about to puke. To this day I can't forget that smell. It took a few weeks before I was able to go down on my girlfriend again. I think that was my deciding factor as far as not going into OB/GYN. I just don't want to encounter the rotting vagina smell again ever.